Maguire.
Thank you, Presiding Officer. To ask the Scottish Government how a public health approach to justice can reduce crime and make communities safer.
Cabinet Secretary Angela Constance.
Presiding Officer, our vision for justice emphasises the importance of the public health approach to justice and community safety. Evidence shows community interventions can be more effective in reducing reoffending and assisting with rehabilitation, leading to fewer victims and safer communities. Health considerations are also key, and we know that those in the justice system often present with high levels of vulnerability and have complex needs. So ensuring access to health and other support services at each point in the justice system is therefore vital and requires a holistic, multi-agency approach, as well as a focus on prevention and interventions which facilitate those links.
Ruth Maguire.
Thank the Cabinet Secretary for that answer. Justice is, of course, largely devolved. However, we see in some of the most challenging issues facing society, drugs, gambling and organised crime, Scotland is limited by Westminster law and policy, and creative, focused approaches can be stifled. Would the Cabinet Secretary agree with me that this is just one of the many reasons that the people of Scotland would be best served by the restoration of Scotland's independence and the full powers and responsibilities that that would bring?
Cabinet Secretary.
Presiding Officer, well said, Ms Maguire. Independence would, of course, allow us, for example, to further embed and extend our public health approach to justice and violence reduction into currently reserved areas like gambling and drug policy reform. As an example, with full powers under independence, future Scottish governments could consider a range of measures to tackle gambling-related harm, such as raising the legal age of gambling or reviewing how gambling appeals to young people. And in relation to drug reform, any future government could consider the creation of a statutory framework for supervised drug consumption facilities, reviewing the drug classification system, clarification of the law so services can provide drug paraphernalia legally, and enabling a wider range of treatment options, such as introducing drug checking facilities as opposed to having to apply to the Home Office.